Hello, my name is Cheol. Today we're going to discuss about the Parkinson disease. This is a very interesting subject. And a lot of people, when they get old, a lot of people they got this kind of disease, and they even Western medicine, they're not clearly saying about what the causing for, what really come from. Still yet it's not clearly saying for that. So however, in our oriental medicine, we don't say we can cure, but we make a symptom better. How? We kind of categorize and then the what the body type, how the build, and then what the coding for, and we try to make a good balance. Okay, so first of all, and Western way we say about the Parkinson's disease is a dopamine deficiency. Okay, and what does it mean, dopamine? This is a neurotransmitter in our human brain, and they have 5 of them. This is one of them, but dopamine is a lack of it. And if I say it's more saying about L-dopa doesn't really changing for the dopamine well, and then ultimately dopamine kind of deficiency. And still a lot of times scientists and then doctors try to figuring out what problem, but still yet it's not really clearly proven or saying and or what really causing for that. But the answer is because dopamine. But nowadays the Western medicine, they give to the patient to the dopamine kind of a drug like a levodopa, duodopa, thing like that. But that's okay. So people taking that and then shaking or whatever is at the moment they kind of relieved. But even that they long period of time affecting, also as far as I know, it doesn't really get effects. So ultimately people have a lot of problem. So the oriental way we're thinking is even the dopamine is great, but we try to make a good balance so that we try to even get up or great reduce the Western medication so that people can naturally get healed for that. So we don't say we can cure, but we definitely help out for that. Okay, make a symptom, worst symptom goes away as possibly. And we figuring out the 4 different things. We have many types of we figuring, but this is one of the 4 types that I'm saying about the. This is the Chinese word, but English we say about the qi. Qi like obstructed. Qi doesn't go well, and blood, qi and blood, stagnation. What does it mean? Qi and blood stagnation means kind of when you imagine for the blood vessel, when blood vessel have to be open, have to be clear circulation, but in this case some kind of stuck in the blood. So why? And maybe the when they're young or they got hit or some kind of accident or so many things. People who are very athlete, like they have a lot of exercise, boxer or some other high level of kicking or very dangerous kind of sport, and a lot of damaging for their body, it causing stagnation. So we, in this case, we give it to the herbs for the 혈부추거탕. Okay, so we have a 혈부추거탕. They have a lot of medication. Good one is like Cheol and Cheol and Douyin. This kind of, there are a lot of things, but one of the important thing is this one is really helping out for the get rid of stagnation. So we're using for that. Okay, and another thing is this one is dampness, and heat producing, okay, them heat producing for the pung, okay, and them heat produce. What does it mean for that? You know, this type is like when they're young, they eat too much meat lover, okay, and then also they drinking and smoking, less exercise, and too much meat and meat lover. Okay, here this kind of type, okay, when people too much drinking, too much smoking, produce a lot of heat inside the body, the also blood is getting thicker, and with the heat and also less exercise and too much meat, okay, meat also producing a lot of heat too, or dampness, cholesterol. So in this case, you know, people poor balance. If that kind of status, poor balance, stay like a long period of time, it causing the Parkinson disease. And so that's why we put a 최관환. It's a 최관환 means get rid of dampness, get rid of heat. For example, 황년, 황금, and 취자. Okay. falsok. There are a lot of many kind of herbs to get rid of for this. Then it really helps for the shaking. Parkinson is getting better. Another thing is qi and blood deficiency. Qi and blood. Shu, what did I say? Deficiency. Okay, deficiency, lack of it. So when they're young, and 20, 30, 40, always tired, always a pale look. But you know, they don't care about the exercise. They don't really care about the good food to make a good balance. Even they endured. Oh, I'm tired. I used to be tired, so I don't care. But if living like that, it causing also the Parkinson disease. So we put a 정진환, and we put a lot of qi producing, energy goes up, and producing a lot of blood. Okay, for example, fungi and tangsam, and you know, a lot of bacteria, and then tangwe. You know, this kind of herbs is really good for the balancing for the qi and blood diffusion. Another thing is liver, okay, kidney, inshu. What is that? People too much stress, too much junk food, like a processed food. Our yin and yang balance is going down. Remember I said about the yin and yang, and minus plus. Yin goes down. When yin goes down, there are a lot of things coming up: cancer, autoimmune disease, diabetes, blood pressure, and one of the Parkinson's disease. So this type of this, they have a lot of time. They have a Parkinson's disease, along with they have a lot of time like diabetes and blood pressure too. So then we put a jaggihan, which means we tonify and tonify for the yin. So we have the herbs like sukji and sanyak, you know, and fangjang, okay. So then you know, it get well, the shaking, everything. So I'm again, people when they're young, too much exercise, too much beat by the, you know, whatever strong sports, or people got accident, having chance. People got too much drinking and smoking, beer and anger, they might have a, you know, Parkinson. People have a so weak, so tired, long period of time, they not even treat for that symptom, they gotta have a high chance for the Parkinson's disease. And another thing is, anxiety, junk food, making poor balance, less exercise, also making the Parkinson's disease. So our oriental medicine, we have the herbs to make a good balance, very short period of time, so that people 2-3 months taking the herbs with acupuncture treatment, the symptom goes much better and less shaking, less trembling, and have a great feeling. So, then even the people, taking the dopamine kind of Western medication, even they can reduce, they're still better, less shaking for that. So you have to be thinking about our medicine always making the balance. A lot of time people think, without having natural way the balance, and then just to try to depend too much the chemical, that's okay, but they cannot get away forever for the drug. But the oriental way that we're thinking is a natural way. So the natural way means, I'm not saying about you only take the herbal tea and the acupuncture. No, this is one of the fast way we making balance. But another also, you are the one only can treat any kind of disease. We make a balance. Ultimately, your body by themselves try heal for that. Okay, that's very important. The way of thinking. What I'm saying about you have to have a good diet. Less meat. Okay. People always thinking, I need to get the protein from the meat. No. Our gene and then animal gene is different. God created us, and then, our gene is slightly different. So if we continuously taking, some kind of animal product, as far as jumping theory mutation, maybe you have to consider for that. I'm not sure about the exactly, I'm not talking about the Western kind of a theory, but the way you have to less taking the meat is a much healthy way. And plus, you have a lot of fruit and vegetable, okay? Juicing, fruit and vegetable. And exercise, I don't say about you exercise 30 minutes, 1 hour. No, 5 minutes, even 2 minutes. You take a walk, and you take a walk 1 mile, half mile. That's great helping for that. And then the other thing is, don't get stressed. Love to other people. You have to love for the human being, even the enemy or people you bothering you, people you criticize to you. Forget about those people. You just escape for that. You just don't confront them with them. But just be thinking like yourself. Whatever something come up, you think about, I'm so happy. I'm most happiest man. You have to think about it. You still smell, you still breathing, you still eating, you still taking whatever you have exercise. That's a great advantage. A lot of people, they can, because they can very sick. So, I'm saying about the bottom line, you have to think about the more like a positive way. When you think of more positive, your body have a good hormone, like a serotonin or, endorphin or whatever comes out. When you get stressed, a lot of cortisol coming out to bothering and, decreasing the immune system. So, you have to be thinking about it. Today, I'm discussing about the Parkinson's disease. So, and have a wonderful day. Have a happy life. Thank you so much. Thank you. Hello.
Hello.
Yeah, you came here because of you have a diabetes and then almost 2 months. How was the progression?
Tôi bị tiểu đường lâu rồi. Giờ tôi chích thuốc insulin là 23 trong một ngày. Uống thuốc nữa, nay tôi chữa bệnh nên nay được còn xuống lại chích còn lại là 15-16 unit thôi. Tôi cũng bị nhức cái bả vai mà bác sĩ vô chăm cứu tôi chỉ có 3 phút là tôi giở tay thẳng lên được và ngang được.
So how many minutes pain goes away?
Biết chu 2 tháng đến gần 2 tháng nay, gần 3 tháng.
So overall, diabetes is good?
Dạ, đúng rồi, đai đường của tôi bị tiểu đường nó nay chữa xuống là rất là ok. Cảm ơn bác sĩ.
Very good?
Very good.
Okay, thank you.
Thank you.
Hello.
Hi.
Yeah, and she came here because of she had a terrible pain, almost 20 years, and then she complaining of a headache. She been to a lot of treatment, and then it never helped for that. And then she had acupuncture. She was amazingly good. Could you explain for that?
Thưa cô, trước khi cô tới đây đó là được biết là cô bị nhức đầu 20 năm rồi, với lại đau nhức, đau vai, tê tay, phải không ạ? Sau khi chăm cứu ở bác sĩ Kim á, thì cô cảm thấy như thế nào? Cô có thể nói cho cho văn phòng với lại cho tất cả các quý vị biết được không cô?
Coi như lần đầu tiên á, mình vô á là ổng chăm khoảng 15 phút thì thấy bớt nhẹ. Lần thứ nhì á là bớt nhiều lắm, coi như là tê tay đồ bớt luôn, đau lưng nữa. Mà nhức đầu khoảng 20 năm, đi nhiều chỗ lắm, chăm cứu, đi bác sĩ Mỹ, đi Việt Nam đồ uống thuốc không hết. Mà nghe trên đài nó quảng cáo quốc thái á, thì mình mới vô thử. Uống thuốc có 1 tháng thôi mà giờ bớt rất là nhiều. Nếu mà ai có bị mà nhức đầu hoặc là đau tay, đau lưng thì nên lại bác sĩ Kim, ổng trị rất là hay.
And how she feels?
Cô bây giờ cô cảm thấy như thế nào?
Bây giờ thấy khỏe lắm, đỡ nhiều lắm. Mỗi lần đi làm không nổi, bây giờ đi làm lại bình thường.
She satisfied our Chamku techniques?
Yes, she said very good.
Very good.
Okay, thank you. So she headache is gone, is much better?
Cái nhức đầu của cô bây giờ hết rồi phải không cô?
Bớt nhiều lắm, bây giờ coi như là nếu mà nói một lần tuần lễ nhức 7 lần. Mà giờ tuần lễ còn có hai lần.
Thank you so much.
You're welcome. Bye bye.
Bye. Hello.
Hi.
Yeah, she came here because she was very sick and then thinking a lot and a very pale look. And then could you explain how the progression it is?
Trước khi chị tới đây đó thì được biết là chị lúc nào cũng suy nghĩ hết, rồi tối ngủ không được, rồi mặt mày xanh xao. Thì bây giờ sau khi chữa bệnh khoảng mấy tuần nay đó thì chị cảm thấy như thế nào?
Em thấy tốt, tại vì trước đây em tới là em bị không có ngủ được, với lại em bị stress á, suy nghĩ nhiều mà không có 3-4 giờ em mới ngủ được 2-3 tiếng một đêm thôi. Rồi huyết áp em thấp, với lại người em nó không có sức, rồi giống như không có balance được cái body của mình nhé. Rồi em uống thuốc được 1 tháng rồi em thấy đỡ nhiều lắm, ngủ ngon rồi khỏe người ra với da dẻ hồng hào. Yeah.
And how she say? How she say?
Oh, she says she feels very good. She doesn't. She can sleep now, and she feel very good. Have a lot of energy, and she doesn't feel pale anymore. Her blood pressure went down. She's very happy.
Okay, thank you. And then finally, and then she looks very good, and then thinking less. So, how think about my acupuncture and the herbal medicine?
Chị nghĩ sao về vấn đề cái chăm cứu của ổng với lại cái thuốc bắc, cái thuốc ta?
Em thấy rất là hay, là vì giống như mình tới đây là cũng có cái duyên với bác sĩ, với lại bệnh thì bệnh của mình, bác sĩ giống như là trồng cây vậy đó, rồi đưa thuốc cho mình thì mình uống vô là giống như là cái đó là giống như là nước với phân bón cho mình vậy đó. Thì giống như mọi người thì nếu như giống như có bệnh giống em thì tới đi rồi uống thử rồi biết.
Thank you.
You're welcome.
Thank you very much. Hello.
Hello.
Yeah, you came here because you have a severe diabetes, and then you had at that time taking 50 unit insulin and 7 pills, and even the 400, and then now you drop like 20 unit and almost 120. Could you tell me before you come here how serious you are now, how you've been changed?
Lúc mà em bị tiểu đường á, cao em đau nhức lắm. Em lên 400, em test là 400, em trích 50 unit, bây giờ em trích chỉ còn có 20 unit. Khi em lên see bác sĩ Kim trên đài, em thấy bác sĩ Kim, em lại cho bác sĩ Kim châm cứu á, thì xuống hẳn đau nhức lắm, em ngủ không được. Rồi sau đó em đi bác sĩ Kim châm cứu hết. Bây giờ hiện tại em hết đau nhức rồi, mà con người em nó khỏe khoắn lắm. Em cũng mong ai bị đau nhức như em đến bác sĩ Kim, bác sĩ đến đi được bác sĩ châm cứu cho rồi sẽ hết bớt đau nhức. Vé đi là good, không có đau nhức nữa. Giờ em rất là vui mừng. Mà bây giờ trong khi ấy em vẫn còn đến bác sĩ Kim, tại vì em thấy em khỏe khoắn quá, em vẫn còn đi tiếp tục. Em cũng mong quý vị nào đau nhức như vậy hay là bị tiểu đường á, hãy đến bác sĩ Kim. Và cảm ơn.
Thank you too. So I want you to keep doing. So overall, I don't understand what you're saying, but overall you like my treatment?
Yes, em rất là mừng khi đến bác sĩ Kim châm cứu với lại thuốc uống của bác sĩ Kim.
Thank you. Cảm ơn.